S. And so let's use the first part of this show to make them familiar with the issue of AIDS and HIV.
Okay, Dr. Haney. HIV stands for Human Immunodeficiency Virus. This is the virus which causes AIDS. AIDS is acquired immune deficiency syndrome. So if a person is human, which is what that H stands for, they have some degree of risk. A lot of people think that, oh, I'm not at risk, but look, if you have unprotected sex, if you share needles, you are at risk for HIV. No matter who you are, HIV is not who you are, but it's what you do that puts you at risk for HIV infection. So again, if a person has ever had unprotected sex in their life, then they need to go and take an HIV test. Now, if a person has ever shared needles or gotten a tattoo from someone other than a licensed tattooist, then they need to go take an HIV test. The only people still assume, oh, I go to the doctor all the time. If something was wrong with me, the doctor would have told me. That is so far from the truth. In order to find out about if you have HIV, you must take a specific test, an HIV antibody test. That's the only way you're gonna find out. Simply going to the doctor, they drawing blood, it's not going to tell the doctor whether you're HIV positive or not. If that blood is not tested specifically for HIV antibodies, they will never know.
And so it's a real issue even today. We talked about that a long time ago.
Yeah.
You're telling me that
HIV is very, very real today. I know that because of the medical advances in HIV medications and medical regimens, that people are now becoming very complacent about HIV. It's not like we used to hear about it back in the 90s, in the early 2000s, but HIV is still very real now, and people are still getting infected at a large number. We have approximately...
And what we'll do, we'll take this first commercial break and we'll come back, and we'll be back with our audience following this very, very short commercial break.
So,
because what you're telling me now is that we don't pay any attention to it now as we did at one time. It was a fearful kind of thing, you see, but people, as you indicate, have become complacent. Talk about that. We got 8 minutes in reference to that, dealing with that.
Okay.
And then when we come back, we'll have 10 minutes, and then this is where you can get into grants or whatever, how you might be able to help, people might be able to help you do what you're doing and what the government is already doing in terms of helping and et cetera. Anything that you want to do, that can deal with that 10-minute segment, but 8 minutes, go on and talk about it like you used to talk about it, you see, because they still need to know. I need to hear it again.
Okay.
You see.
I want to make sure. Okay, we're good. I just want to make sure this thing don't fall out the seat, but it's good. Yeah, it's got a back.
1 minute.
Welcome back to the second segment of the show for today. We're talking to Mr. Ron Crowder. and he's given us some information in reference to HIV and AIDS. As a matter of fact, Mr. Crowder, as we indicated earlier, the topic is AIDS and Streetworks, indicating the organization that you've established at an earlier date to deal with this as an issue. Let's talk about it in terms of what we were talking about earlier.
Yes, Dr. Haney. As we said right at the break earlier, since HIV is not being mentioned a lot in the media as it previously was in the early 90s and in the early 2000s, people has become complacent with HIV. But what they really need to know is that HIV is still very real, and it's still an epidemic and a pandemic. So HIV, right now we're having somewhere around 56,000 new cases per year in the United States. And that hasn't changed over the last 5 years. Always it's been an epidemic among minorities, African Americans, Hispanics. It's always been an epidemic. Minorities has always been disproportionately impacted by the disease. Now what we're seeing is minorities is still being impacted disproportionately, but the majority of the new cases, probably 70–80% of all new cases, is among young gay black men. So now we need to start targeting that population in order to reduce the new infection rate. One of the other big things that's going on now, and it's been a while, is that care is prevention. In other words, what we're trying to do now is make sure that if a person is infected, we find those people early so we can find all of the people who are infected and don't know that they're infected, get them in treatment, get their viral load to undetectable levels. And I don't know if you remember way back when Magic Johnson, at one time they were saying Magic Johnson is no longer infected with HIV. Well, that wasn't the truth. What was going on was that he had an undetected viral load. Now, what we know now is different than what we knew back then. We know now if you get the viral load of a HIV-infected person down to undetectable levels, the chances of that person transmitting HIV is slim and none. So he have a very small chance of transmitting the virus. So what we know now is that those people who are HIV infected and don't know that they are infected, they are responsible for most of all new infections. So our job now has become different than it was back in the day, back in earlier days. Our job now is to find people who are HIV positive and don't know that they're positive and get them into treatment. Also, the second part of that is to find people who are HIV positive, know that they're positive, but for some unknown reason, they have fallen through the cracks or they have fallen out of medical care, and get those people back into medical care where their viral load can be reduced, where they won't be transmitting the virus to other people. So that's our job now.
And so that's a much more difficult job now, because what you have to do is to find folks who don't know that they have. And how do you go about finding folks who might be susceptible to this disease but don't know that they have it? I mean, what's that process?
This is what we do. We try to have our HIV prevention efforts targeted toward people who are at a high risk for HIV infection. And I don't want to seem like I'm pointing a finger at nobody, but we know that there are certain populations of people who are at a higher risk than other populations. for example, men who have sex with men, they are at a higher risk than heterosexual men. We know that black women are getting infected at a higher rate than other populations of people. So we start trying to target our prevention efforts at those populations of people who we know are at a higher risk. People who use and abuse drugs, those populations are at a higher risk because when they are trying to get drugs, the women trade sex for drugs, and if they're IV drug users, then they are sharing